I'll take this off to start. I'll put it on afterwards. Hi, everyone, and welcome back to another episode of Mom Strength. This is your host, Surabhi Veach, and I'm really excited to have on today Dr. Rachel Ollivier. Rachel and I connected through email, actually, and she shared with me her research. And I was like, this is something that my audience really needs to hear about. She's a nurse practitioner and a clinician scientist based at BC Women's Hospital. So for those of you who are not in Canada, BC is British Columbia. It's in the western part of the country, where she practices in both women's cardiac health and complex gynecology. She completed her PhD at Dalhousie University in 2022 and received her primary healthcare nurse practitioner diploma from Queen's in Ontario, Queen's University in 2023. Her doctoral research aimed to explore sexual health after birth, which is her area of expertise and what she's here to talk to us about today. Dr. Ollivier continues to be a courageous advocate for maternal and women's health, both locally and globally, and has also received numerous awards for her work, which most recently included being named one of North America's top 25 women of influence, which is incredible. Congratulations on that. Welcome to Mom Strength. How are you doing today?
I am doing very well. Thank you, Surabhi, and thank you for having me.
So let's get right into it. Now, your research is focused on sexual health after birth. Can you talk about some of the components of health after birth and some of the components that influence sexual health after birth?
There really is such a spectrum of, factors and things that influence sexual health after birth. And what my research really showed was how those facets, really can be coming from kind of that physical component, the emotional, the relational, the social, all those pieces fall into it. And when we look at the World Health Organization's definition of sexual health more broadly, it includes those components that go beyond the physical as well.
Amazing.
So in my research, there really were different themes that kind of touched on each of those aspects of sexual health, some of which included body image and how that was very connected not only to identity, but how the meaning of the body shifted and certain body functions shifted. There's that, redefining emotional intimacy and what that looks like for people, whether it included sexual activities or not. That was something people really redefined in their relationships. And then we also saw more of the medical, the institutional, that piece with the 6-week mark, the meaning that people ascribe to that and how that also very much varies. So there is, again, a spectrum in terms of people's experiences when we look at, breastfeeding, at the relationship with, your partner, if you're in a relationship, and just all those changes that are happening and sort of navigating not only kind of this, now experience of being postpartum, but all the changes that means in terms of, being a parent and navigating that role and that identity of, yes, being a mother and a parent, and also a sexual being. So excited to kind of get into things more today, but that's
yes,
the synopsis, if you would say, of the main findings.
And I'm so excited that you mentioned that, the role of being a parent or mother and a sexual being, because so often I know for myself personally, you see it as one or the other. You see yourself as a milk producing machine that this baby is latched onto at all hours of the day and night, or you see yourself as sexual, maybe when you dress up and you go out for a date night. And so seeing yourself as both it's important, but it's sometimes hard to navigate. So let's talk about maybe one of the first most obvious things is body image postpartum and how that changes and how that can influence your libido and your feeling of feeling sexy in your body, and your desire.
Absolutely. And with the body image piece, a lot of people in my research talked a lot about, of course, we think of abdominal changes or breast changes, weight changes after birth. And it was also kind of one where, again, the example comes up of how, identity as a mother and identity as a sexual being, I think often in society is sort of positioned as being in opposition to one another. Again, then therefore creating this assumption that you can't be both. And a lot of people said, hey, I am a mother, I'm still a business owner, I'm still a this, I'm still a that. All these roles were still part of how people define themselves. Mother was one that was added to that list. And it's an important role, but
it doesn't replace the other things.
Exactly. It wasn't their only role. And so same with kind of the body. It's sort of like, okay, I'm using my body in different ways now. People might be breastfeeding. Things might look different. They might feel different. So in terms of the body itself, I think a lot of people are sort of navigating, okay, what are my expectations around this? It's not necessarily that I want to look like I did pre-pregnancy. There wasn't necessarily something that they were expecting. But in terms of, say, the function of the breast, it was for some a lot of just like, I remember one saying, she said, right now my breasts are for my baby and not so much for my husband. I feel like a bit of a cow right now. She used that word.
Absolutely. Yeah.
But it is. And, at times you can feel touched out as well, where, at the end of the day, just even having time alone with no hands on you is nice.
Yeah.
So that really is, again, something where the breast, you're having kind of these new sensations. Often another thing we don't talk about as well with the body is, for some people, feelings of kind of arousal during breastfeeding, those cuddle hormones coming in. So things like that are normal, but we don't talk about it. So
you see,
that's like,
I've heard of that happening. Didn't happen to me personally, but I've heard about that happening. And there's so much taboo even around that. And it makes sense from, your breasts are being stimulated, your nipples are being stimulated. But at the same time, I also don't want people to assume that breastfeeding is sexual in any way. Like, it is a breasts can be sexy, but they can also be milk producing organs for our babies, nurturing. So it can be both. And I was like, nobody's touching my nipples, because anytime anyone would come close, the milk would spurt out and it would just be a mess. And, I found that it challenged what I would consider as sexual touch and forced us to be more creative or find different ways to connect, even physically, that didn't involve the same type of touch it did prior to, having my children. So that's something that I think is really important to address, is like, the breast changes, the belly changes. For people with pelvic floor perineal tears, that's a huge area of self-consciousness around that as well. I don't know if your research went into any of that, the pelvic changes postpartum.
Absolutely. Some people talked about that for sure. And I had a few who had, more severe degrees of tearing, sort of in the third or fourth degree categories. And it was absolutely something that I think with that, there was sort of this shift of, okay, I see my vagina as something that sort of gave birth to the baby, and, my vulva, my vagina, my pelvic floor as having that function now. So then it was sort of returning to, okay, this also can be something that I can feel pleasure from. Rather than having it be, again, the whole childbirth experience, which is, as we know, very, very painful, can be traumatic, both physically and emotionally. So that was one shift that happened for people, was, okay, the meaning of, of that part of the body and the function of that part of the body, the multiple functions it can have. And also navigating pelvic floor recovery for some was absolutely on their mind, because, for some it was difficult. I talked to a few who were kind of at the 6-month mark and still having quite a bit of pain. And, for one, it was sort of, she said, I still want to have children. Like, that's my concern right now, is not even the sexual activity part, but I need to be able to, have sex
so I can have another child. Yeah.
So that was where her mind was.
Yeah.
And for others, it was, again, navigating, getting care and knowing what to ask for or not knowing what to ask for, depending on if it was kind of their first time having a baby, their second time having a baby, and knowing kind of what they needed around that. But, we're seeing it expand, where now we're talking about pelvic floor, which is so wonderful. But still those expectations can kind of, again, be shifted for sure. So there was, that, and then the feeling of fear a little bit. People talked about that, of being fearful of pain when returning to sexual activities after birth. So one thing that people talked about in my research was actually using masturbation as a way to kind of learn their bodies in a way that felt safe, that felt comfortable, even before necessarily engaging sexually with their partners again. That was a way that some people kind of said, okay, this is really helpful for me to just see where we're at. And rightly so, right? It's, again, that fear of pain is absolutely, you can see that's, again, this has been a lot of changes. So that was, I think, a way that was very interesting in terms of, how people sort of navigated that and took agency and got to know their bodies again.
That's fantastic. I definitely, and this is kind of a plug for pelvic floor physiotherapy during pregnancy, even prior to conception, if you want that.
Absolutely.
Because I find that the clients that I've worked with during pregnancy tend to have better birth outcomes in terms of reduced risk of tears. Even if they have a C-section or an emergency C-section, they've already practiced connecting to their core and pelvic floor. We've had some of these conversations during pregnancy, so it doesn't come as a shock postpartum. And so if they do have any tears that they're dealing with postpartum, they also know that this isn't how it's always going to be. Sometimes when you're dealing with all of this by yourself without any support, you think, oh my gosh, this is how my vagina looks at 3 months postpartum, is how it's always going to look and feel. It poops, or when I'm pooping, it hurts. So it's always going to hurt when I'm pooping. When I, touch my clitoris, it hurts, or I don't feel anything. It feels numb. It's always going to feel like this. And through pelvic floor physiotherapy, virtually or in person, I work with clients all over the world virtually as well. There's so much progress we can make. And so I love that from what your research is saying, there are people who are 6 months postpartum that are still experiencing these issues. So it's not just a first few weeks postpartum thing. This is a long-standing, it can persist into the first couple of years postpartum, and even more if you've never gotten help. And masturbation is it's an interesting topic, because many of the people that I work with, they have never masturbated, or they find that it's uncomfortable to talk about because they think that there's something inherently wrong with it. But only if they're female. For males, masturbation is totally normal, right? It's normalized in our society, and for females, it's not. And there's almost a sense of sex is for my partner. Sex is something that my partner does to me. It's not something that I can do for myself. And this ties into the cultural part. I don't know how much your research considered that, just the cultural influences or religious influences of perceptions of masturbation or self-touch or self-pleasure, because the people who are unable to or unwilling to explore self-touch took a little longer getting better, because their partner is having to do all that work for them rather than them having to do that initial legwork, right?
Absolutely. And it brings up, again, an important conversation in society more general, but also the power of that personal knowing. And that was one of kind of the sub themes in this work as well, was that theme of trust your gut. So even though kind of, they were having certain messages from, say, society or their healthcare provider or whatever it was, there was still that theme of, okay, I know my body best. At the end of the day, you're the only one who can feel what that's like and who has that sensation. And with that, it is, but it can be difficult because it's, again, it comes into so much. We don't talk about these things enough. Pregnancy, prior to pregnancy, postpartum, as you're saying. And it's so powerful having, for the participants who did seek pelvic floor physiotherapy, their experience with that was so positive, because not only did it give them information about their bodies, but they felt it was really powerful being able to kind of have that assessment of, okay, this is exactly where perhaps the issue is, or where the weakness is, and
or why I have pain here.
Yeah. Or why exactly. And it validates that experience and gives them tools to, again, be able to see the light at the end of the tunnel in a way, especially during those postpartum days where there's so many ups and downs. And it's something that really everyone found was so positive in terms of their experience. So I support it to the end of the earth.
I know. I wish it was more accessible to everyone. Right. And, right now in Canada, there is no, like, I know in some countries there's like 6 pelvic physio sessions postpartum,
publicly funded.
Here it isn't. I'm actually applying for a grant to see if I can do some prenatal education, because I think that, like what you're saying, the education and empowerment of, like, this is what's happening, the knowledge of understanding helps ease some of those fears, especially postpartum when you're so sleep deprived. Every small worry can seem huge when you're not sleeping well. So having someone remind you that, okay, this is normal for where you're at, but this will improve, this is how it's going to improve, can help ease some of those worries. Can you talk about some of the relationship stuff? Because I know that many people are concerned, if I don't give my, spouse this, sex 3 times a week or once a week or whatever it is, I'm a bad wife, or I'm a bad, yada, yada. And this, they might go seek this elsewhere. Like, there's this societal pressure. I've never felt that in my relationship. And I think that if you felt that in your relationship, there's some issues there, or there's some societal issues there that are, stimulating those types of thoughts, but what did anybody share any thoughts around that in the research that you've done?
They did. And with that, it was about really redefining kind of what intimacy looked like to them. So we know, and it's well evidenced in the literature, that generally there is a decrease in sexual desire after birth. But what the participants in this study showed that was new was how they redefined intimacy within their relationship and still valued intimacy. So that emotional connection for the people I interviewed was still very important, as was maintaining that emotional closeness and connection with their partners. However, they redefined kind of what that looked like for them. And it didn't necessarily need to include sexual activities, which is kind of something that, again, was, shifting after, from pre-pregnancy to postpartum. And it was something that it was a way of them ensuring that their needs were met while also, respecting their boundaries and kind of the time that they needed or whatever that was. And I remember one participant really kind of honing in on that. And she said, I think for some, people, she said, I would be embarrassed to say, we're at 2 months and we haven't had sex yet, because people naturally assume that there's something wrong with the relationship or there's something wrong with me.
Yes. Yeah.
And that was really powerful because she really illuminated some of those social discourses that exist and persist in society about what's expected within relationships. We have these discourses that shape sexual activity or sexual intercourse as sort of the best way or most valid way of, being intimate or showing affection. And that's not necessarily true for all people at all stages of life. I always say sexuality is, an evolution throughout the lifespan, and postpartum is no different. So I think, again, it was really powerful to hear about some of the changes that people made in terms of just redefining how they kind of, again, kept that intimacy, kept that closeness, but knew that it didn't necessarily need to include sexual activities at that time.
Yes.
So no, it was interesting to hear about it from some people, for sure.
And that part alone, that like intercourse, even without intercourse, if you have a vulva, you can experience fantastic, great pleasure. You don't need intercourse. So if you have fear of penetration, if you have scar tissue, you can still have sex that is pleasurable for you. If you have a partner with a penis and they typically get off of penetration, there's other ways to have pleasure even for someone with a penis. So sometimes I think we live in such a heteronormative socio conditioning of like, this is what sex is like. And unless you've gotten back to penetrative sex, you haven't had sex postpartum. And there are people who are having oral sex, they're doing all sorts of other things, but they still feel unsuccessful, as if there's some benchmark or, gold standard for what sex is. And I think that whole piece of redefining intimacy can also be redefining what sex actually means to you and what pleasure means to you. Because let me tell you, it can change throughout our lives. And for me personally, it's changed through both my pregnancies and after both my babies. The things that you found pleasurable before, you may still find pleasurable, but you might find other things more pleasurable now. So there's nothing wrong with that. And that's absolutely okay. And I also think that there's this stigma, not stigma, but people don't talk about it. But because I work with this population, most people are not having sex at 6 weeks postpartum.
Yes.
Most people are waiting for months, 3 months, 6 months. Sometimes people are waiting for 9 months, and that is okay. There's no rush to get back to it. And it doesn't mean your relationship is failing or that there's a problem with your relationship, right? And can you talk about some of the ways people can cultivate emotional intimacy if they're used to having physical intimacy as the main event?
Absolutely. And, there were kind of examples in my research of people just sharing, even just kind of that flirting, that sense of humor, cooking together, having time that was that quality time together, being able, one was saying, she said, even when, once the babies are down and just having time to just sit together on the couch in silence and just talk was very nice. And again, it's sort of just, again, sort of keeping that, that sense of partnership. I think for a lot of people, it was feeling like they had a partner in this experience and, could still have someone to talk to and to, do dishes, do laundry. It's, sounds like it's, again, not something very sexy per se, but it was that piece of support and feeling supported through everything. So that was important for people. And I remember one kind of joking, I said, we cook together in the kitchen. That's honestly my favorite time together is cooking in the kitchen and like spanking each other on the bum, and that's just, that's how they interact, and it's funny, and they still have that, again, that way of showing love and affection to each other. So everyone kind of had different examples that they shared of ways that they're kind of like, oh, I enjoy that. I enjoy that we do that, in terms of kind of what was best for them in their relationship. So it's all about kind of, again, the roller coaster of ups and downs, and hopefully being able to laugh at it a little bit as well. So
yes, because it is, you have to have humor, otherwise you're going to go like nuts. And
yes,
there is a sense of there's an expectation that as men they'll be so like not on board with that, right? That they're gonna need sex, otherwise they're gonna like decombust. Like, men are understanding, like, again, depends who you're with, but like having these open conversations, and sometimes they're too exhausted too, because they've been up with the baby, they've been sleep deprived for just as long. Depending on the partnership that you have as parents, there's this expectation that, and I think sometimes it's people who don't even have children who have this fear of this is what's going to happen after having kids. But the reality isn't that, right? The reality is you're in a relationship, you're on the same team instead of like one versus the other. You're both working on this together. So I like that, cooking together, sitting on the couch. I can vouch for that. Sometimes you put the kids to bed and you're like, I just want to sit for 10 minutes before doing the dishes or folding the laundry or working or whatever else that needs to happen the rest of the day. Okay, so let's talk about the 6-week check. Why is that a thing in our society?
So how and why it became a thing is still in a way elusive to me, because in the research and in the evidence that we have, there actually isn't a ton of reason for the 6-week check medically, besides the fact that it sort of is something that tends to coincide with when that check is happening for other reasons. So to assess physical healing, to assess mental health, to assess baby's health, all those things. And it kind of tends to be, again, a convenient time, so to speak, to bring sexual health up, if it comes up at all. So here's
yeah, that too. Yeah.
Here's the catch. If and when it comes up, based on what we know in the literature, it tends to be a conversation about contraception. And so with the 6-week check and discussing that in my research, it was interesting how it came up. When people ask me what most surprised you about your findings, I always say this, because it came up when I asked people, what was a moment when you thought about your sexual health postpartum? Whether that was, when you were in the shower or in the drugstore, whatever it was. And every single one said, you know what? The 6-week check, the 6-week mark. So it was a really meaningful.
Yeah, probably, because I was like, I don't even
people.
remember thinking. Actually, yeah, I'll tell you my story after, but I want to hear what you're saying.
Okay, sounds good. And so it was, I mean, not that I expected it to not be a thing, but it was really such a strong theme in the findings. So with that, the 6-week check was defined differently by people, I think. For some, it felt like a bit of a deadline, where it felt rushed. It felt like it was too soon. It felt very arbitrary. That was definitely something that came up in the themes. And for other people, it was kind of, I think could feel like a milestone, where it was sort of like, okay, we made it this far. We're at the 6-week mark. So it could have that positive or kind of more negative meaning to it. And that also shifted as people made their way through the postpartum period. But the 6-week check, again, had that meaning of, I think for some feeling like, okay, am I supposed to be feeling ready? Because I'm not.
Right.
And also navigating kind of that, what we call like sort of a bit of a medical discourse, or that norm that exists both socially and I think within medical practice as well, of sort of seeing the healthcare provider as, okay, wanting that green check mark, that approval of, okay, things are safe. People did value that from their healthcare providers. So whether that was, an OBGYN, a midwife, a nurse practitioner, whoever it was, pelvic floor physiotherapist, they did value that kind of that green check mark from their healthcare provider.
Because you want to make sure you're not going to get an infection, or that things are healed. Yeah,
exactly. You want to feel safe, but it was still, again, okay, so this is what I'm hearing from my healthcare provider. But back to that theme of trust your gut. This is kind of what I'm feeling, internally, emotionally, or, in terms of kind of fear of pain, or what those things might be. So it was sort of that navigation of kind of balancing that, which can be difficult when, you're kind of, I remember once you saying, I just really felt going to that appointment such a sense of dread in a way, or that kind of category of emotions, because she really was like, please can I have a few more weeks? Please, it was sort of like, okay, I'm not ready for this. And then, what am I going to tell my partner? Sort of that was on her mind of, okay, after this appointment, how am I going to navigate that conversation also with my partner? Because I feel like that's being expected in a way, and not that she felt pressured at all by anybody. But it was just these norms that
It's these
are
norms.
there,
Yeah.
Yeah.
I find anytime we give numbers, like this is what an average baby should weigh. So you know that every mom who has a baby slightly less than the average feels like a failure, right? Like it's these like, oh, and if you didn't have this, then you just automatically are against this benchmark. So there's no 6 weeks. I think the reason the 6 week check is there is because tissue healing, soft tissue healing on average takes 6 weeks, but that's it. It's not even if you do an internal check as a nurse practitioner or a midwife or an OB, you're not evaluating what sexual penetration will actually feel like, because unless you're inserting something that's about the average size of a penis or the partner's penis, you actually have no idea. In a pelvic floor physiotherapy examination, we assess deep pelvic floor musculature, superficial pelvic floor musculature, endurance, strength, mobility, pain, all of those things. So this is where often if you're able to see somebody at 6 weeks postpartum or 6 to 8 weeks postpartum for that internal check, that can help you feel a bit more prepared. And the other thing is many times it's closer to that 3-month mark, right? And
yes, definitely.
just because 6 weeks is barely just scraping the surface. If you've had any tearing or any complication,
assessment, physical recovery, as you're saying, but the sexual piece, the sexual health piece is totally different.
It is.
Yeah.
And sexual health is, it's one thing to say you have the all clear on masturbation at 6 weeks, because that's you and you. But if it's you and a partner, there's so many other layers, like you've already mentioned, the emotional piece, the well-being, that piece as well. I know that for me, the first time I thought about sexual anything was when I was on my way to HomeSense. My husband and I, he took pat leave for the first couple of weeks, and we were on the way to HomeSense to buy like a picture frame or something for my newborn's photo. And I'm getting out of the car and I get this call, and it's from Toronto Public Health nurse. And she's like, hey, just wanted to see how you're doing. I have a questionnaire. I'm like, okay, that's fine. She's asking me these questions like, are you depressed? And I'm like, no. Like, it's so direct that you're like, no, I guess not. Like, but if she had asked me, and then she's like, just so you know, if you're exclusively breastfeeding, you don't need contraception, because that's, you can't get pregnant if you're exclusively breastfeeding, which I knew at that point was false, thankfully. But I'm like, this was in 2018. This was not that long ago.
Okay. Yeah.
So I'm getting a call from a public health nurse telling me that. And that was at like 10 days postpartum, 12 days maybe. I wasn't thinking about sex. And I'm like, is this really the priority of the conversation right now? Like,
yes. Yeah.
So it just seemed so. I think that a better way to approach it, instead of saying you have the all clear on sex, is asking the person, like, how do you feel about your sexuality? Is this something you're interested in? Because that's what I usually ask. And a lot of the times they're like, nah, not really. And that can be the case for months. And I don't think there's anything wrong with that, because we've already identified you're touched out, you're exhausted, you have new demands. But if the person is interested, but they're not having sex because of fear, pain, all of these other things, and those are things we can talk about during our session. So anyone who's listening, don't feel pressure at 6 weeks. It's not a benchmark, it's not a gold standard, it's just a guideline. And if you want to tell your partner that your doctor said no, then that's fine, you can say that. But I would say it's ideal if you can have an open conversation with your partner that you don't feel ready, and there should not be any pressure. If it's, hopefully there's no pressure. And sometimes I've worked with one of my interviews was with an intimacy coach, and she works with new moms. And it was a really great conversation, because she talked about how intimacy does shift postpartum, and that many times the male, if there's a male spouse partner, doesn't understand that, because they haven't experienced that in their bodies. So to them, they're experiencing the same things you are: sleep deprivation, exhaustion, but they don't understand all the physical changes that your body's gone through. And often as women, we don't feel comfortable talking about those changes to our partners. We don't feel comfortable saying, oh my gosh, my loose skin makes me feel so unsexy. We internalize that, we keep it in. And so these conversations never come out in the open. So I think that for people who are really struggling with that, exploring an intimacy coach might be a great idea too.
Definitely, definitely. Yep. And again, that 6 week is my main message always is it is not a one size fits all.
What in your research, I'm curious if you did any interviews on the partners, if the new moms had partners, on like what their view on all this was, or maybe if the people shared themselves, if they had any interactions with their partners and spouses.
Some talked about, yeah, kind of interactions with their partners. I interviewed people who had a postpartum experience. Just in the literature, I'll actually, when there is, research on sexual health after birth, it does actually tend to explore things in the context of couples. And so
Yeah.
I kind of wanted to do something a little bit different and really delve deeper into sort of the individual experience.
Yeah.
Again, not to say the partners are not relevant at all.
Yeah. Yeah.
Obviously, a very important component of it. But yeah, that was my approach in terms of filling the gap that was there a bit, but
Because
people
that's
absolutely
true.
talked about it.
That's a
Yeah,
huge gap,
yeah,
right?
yeah, it is. Yeah. With that. So some people did talk about kind of the interactions they had. All of the participants in my study, thankfully, did feel very supported by their partners through everything.
That's awesome.
And some kind of, yeah, mostly when they did share it, it was sort of about learning to laugh about things. I remember one sharing a story about they were sort of re-exploring things in terms of sexual activities, and there was kind of one point where I think his fingers were almost stuck a little bit in terms of internally. And they were sort of laughing about, oh my goodness, we're gonna have to go to Emerge or something like that. They were laughing, but she kind of came up because she was like, my pelvic floor, which is another myth that I'm sure you've talked about, what lots with clients and on the podcast as well. But there's a lot of that tension, that pelvic floor
So
and
much
muscular
tightness.
tension, there as well. So it was something where she's like, yeah, I think his fingers were stuck for a bit and we were freaking out. So there's again
Yes.
kind of laughing
Yeah.
about things like that. But yeah, it was one she kind of an example she used to talk about, again, that myth that, people are, quote unquote loose after birth.
Loose and wide
And
open. And you know what?
oh my
That can
goodness, yeah.
happen. But I do see more often than not, while there's a little weakness, there's also tension, there's
Yes.
tightness. And when you just think about it from a standpoint of when you're sleep deprived alone, even if you're just haven't had a baby, you're going to hold more tension in your body. Nervous system's going to be more on edge. Now, add to that, you just had massive physical trauma that, came through your vagina. Everything is stretched and now your muscles are trying to heal. Your fascia is trying to heal in the shortest way possible. So it's the quickest possible. So things can be tight. It can be tight even with a finger or, tampon cup,
Yep,
never
tampon,
mind a
yep.
penis. So a lot of people postpartum, when they finally get their periods, they're like, I don't feel comfortable using tampons anymore. Or I just wear pads now, or they might not feel comfortable with the cup yet. And those are things that we can work on again through pelvic physiotherapy. But such an important factor is laughing about it and just letting it go. Queefing is another big thing. Is like
Yep,
you're making sounds like you didn't before because things
yep,
are different.
true.
Things feel
Yep,
different.
smells could change, all
Smells.
that stuff.
Oh, and
Yeah.
the BO when you're breastfeeding and you're holding a
Mm.
baby all the time and your body's like raging hormones. So it's all different. And you just have to understand that intimacy is sometimes messy. So, it's okay. So, you're not alone in any of this. For those of you who are listening who are postpartum and feeling alone, just know that whatever you're going through, someone else is also going through. And because we're not talking about it, we assume that we're the only ones navigating this. I had a friend who had a C-section and she was like back to having sex, had an amazing sex life, or they were having sex 4 times a week. And she was talking about this. And I remember thinking, oh, what's wrong with us? Like, we're not doing that. But she didn't have pelvic floor dysfunction. She didn't have prolapse. She didn't have leaks. So she had a different relationship with her pelvic floor than I did, for example. And so a lot of my clients who struggle are also with prolapse. So if you're listening to this and you're like, I have prolapse, is my partner going to feel it? Is it going to look weird, feel weird? Most people cannot even feel a thing. And sex is actually good for people with prolapse because it's going to push it back in, and it's blood flow. Blood flow is so good for healing, right? So orgasms are fantastic for pelvic strengthening, fantastic for healing. Whether you have penetrative sex or not, it's really, really good for healing. So don't feel like you have to hold off on sex or sexual activity because you have a prolapse or you have, anything new in your body. Um, if you could share one thing, like a key message for new postpartum people on navigating their sexual health postpartum, what would it be?
This is something where, as the old saying goes, knowledge is power. I think really because I kind of asked the same thing actually of my participants in this study of if you could talk to yourself 2 weeks or 4 weeks or, your past self, whatever timeline that was,
Yeah.
what would you say? And I think a lot of them really said, I kind of just wish I knew more about what to expect or what things would be like.
Yes.
So they were telling their old selves, no pressure, as we've kind of talked about in our discussion today. But also kind of being okay to seek out those resources early, anytime. I always say it's never too soon and it's never too late. But
Yes.
kind of, the more we have these conversations that showcase different experiences, the more we normalize those different experiences, right? So it is powerful in that way as well. But yeah, my message is always sexual health is a component of your postpartum well-being. We don't acknowledge it enough in society. We don't acknowledge it, I think, necessarily enough as healthcare providers either. Especially sometimes with time constraints or whatever it is during appointments. I realize there
It always
too,
seems like it's less important than,
yeah,
maybe blood work or your iron levels or
yes,
other things that are maybe a bit more
yeah,
urgent, like your thyroid, right?
differently, than other aspects of health.
Yeah.
But yeah, again, that is my message: is knowledge is power. So whatever that
Good.
support looks like for you, it's okay to seek it out. It's great to seek it out. And we're having those discussions more and more about, again, things like pelvic floor physiotherapy and all
Yeah.
those. So it's nice to see the shift.
It
Um,
is. And for
yeah.
some people, I always say if you can't afford pelvic floor physiotherapy, even one session can do
Mm,
wonders because it can
mm,
help with that knowledge and understanding of what's going on in your body, maybe a pathway of this is how progress will look like, this is what you can do. And many people are actually doing things that impede recovery. So, what I mean by that is if they have prolapse, if they have pelvic pain, they avoid sex, they avoid self touch, they avoid self pleasure, they avoid activities, they avoid exercise because things hurt. And that actually
mm.
makes it all worse. And they think, oh, I have a prolapse, I got to clench more to hold it all up to prevent my organs from descending down, and that tension actually worsens symptoms. So seeing a pelvic floor physiotherapist who can help educate you on why all this stuff is going on can change symptoms just like that. Like it really makes it can be night or day. And I love
It's
that you said
powerful.
that sexual health is also part of your health.
Mm-hmm.
I think a big part of that is this happened to me too, is my body had changed. I looked different. And despite still being, in a relatively thin body, I was like, I don't see many thin people looking sexy who have a belly, who have loose skin, who have stretch marks. We don't see billboards and posters of that. We don't see mothers being shown as sexy. And I mean, what we see is 15-year-old models on billboards, right?
Yes,
And
yes,
so
true.
that's messed up in itself. So apparently we can
Yes.
only be sexy for the first 1/4 of our life, and then it goes downhill from that. So, this is why I start to also challenge the start seeing yourself as sexy no matter what you look like, with the messy hair, with the sweat on you. Like it's not like you suddenly become unsexy just because you've birthed a human. In fact, there's nothing more sexy than that, right? Um, so yeah, a lot of rewiring some of the thought patterns that have come to us because of the way we've been conditioned. And the only way we can unlearn that is by being aware of our own thoughts in the first place. And I like to ask my clients, like, what are some of your beliefs around your body? And um, I also see a big difference when I've worked with them through pregnancy because they have better expectations postpartum and more realistic expectations. That's something that I wish everybody has an opportunity or access to do. I have some questions for you at the end of the show. Some thoughts about yourself. I would love to know, as a PhD, as a nurse practitioner, a very busy person, you travel. What do you do for self-care every day? Some 3 simple things that you do for yourself.
My 3 simple things. I love to either go for a walk or a run every day. That's my
Nice.
time to listen to my music, just process things or check out whatever I need.
Yeah.
So walks or runs every day. I do also like my baths or showers at the end of the day. That is very relaxing for me.
Yeah.
And my tea. My mom calls me a tea granny. I love my chamomile tea. Sleepy
Oh,
time
nice.
vanilla. If everyone's looking for a new, pre-bedtime tea, I love my sleepy time vanilla before bed.
Sleepy time vanilla. I've never tried that because I've actually never tried that. I'm going to try that because I'm trying to do less caffeinated teas because
Yes.
I'm
Yeah.
becoming
Same. I
more
try to
sensitive
not
to
do caffeine.
caffeine.
Yeah.
Listen, I don't know if this is getting older or what, but I'm way more sensitive to caffeine now than I ever was.
Yeah.
And
Yeah.
like I'll have a chai at like, I don't know, 3 p.m., which is when we like 4 p.m. is when our family usually does like tiffin or like snack and we have chai. And now I can't because then I'm up till 2 a.m. Like it really
Mm.
does keep me up. So love that. What are you really passionate about right now? Doesn't have to
I
be work
mean, sexual
related.
health after birth is obviously my work, but it's really, I'm passionate, I think, about having that lens of being in the research and the clinical work. I feel so
Yes.
lucky to be able to do that.
Yeah.
So you talk to me about anything women's health, and I'm right on it. Love having the conversations.
Yeah.
But yeah, I think professionally that is again my area of passion, and
Nice.
personally, it's been a year of travel for me. So I'm really, yeah, excited right now about learning, seeing new places. I've been fortunate to
You
have these
you
past
came
few
out of the
months
pandemic and you were
be
like,
full of that.
I'm going traveling.
Yes, yeah, yeah. The past few months for me, that's been kind of this
That's
time in my
awesome.
life has been full of travel. So again, very lucky.
That's fantastic. And what you said about being a researcher and a clinician is rare because we often see people who are one or the other. And so being able to actually combine that research brain with the clinician brain is huge because research doesn't always translate to clinical, experience and vice versa. So that's awesome. If you could change one thing about the world, what would it be?
I would have publicly funded telephone physiotherapy for one.
Yes,
I think it could. I really think it could change the world.
I
But
really
no,
think so too.
that's how I pine for sure. And I've read a book twice now by Bell Hooks called All About Love, which I would recommend to anyone who's looking for a good
Yes,
read. But she says there can be no love without justice, and that
yes.
abuse and neglect negate love, whereas care and affirmation, the opposite of abuse and humiliation, are the foundation of love. So my rule is, yeah, more empathy and more care. So that's sort of
Yes.
the quote I draw on from Bell Hooks.
Anything from bell hooks is just amazing.
Amazing.
So,
Yes.
what do you think is your biggest strength?
I think my biggest strength is, I think being adaptable has been important in my life and in my personal life and professional life. I think that's something that I do, and kind of like, or I'm glad that I have in a way. And hmm,
Yeah, adaptability
yeah,
is so key, especially if you like some of us are so resistant to change and so stuck in like this is how it has to be. And adaptability is also a great skill to have as you for people who are pregnant or postpartum, because the more type A and rigid and, I got to do things this way people are, the harder that postpartum transition can be. And that I speak from a personal experience. I have become so much more chill. And my friend told me this would happen. She's like, oh, you'll become more relaxed after having kids. Cause I'm like, how is that possible? You have more
right.
you have more responsibilities, but it's true because you have to be. Otherwise you go insane, right? Trying to have everything be perfect and tidy all the time. And, for those of you who are watching this, like I've got mess. There's mess around me. I've got boxes here I got to clean up. I still have Diwali decorations out. Next up is going to be Christmas, and there's both the decorations are just all over the floor here in bins. So it's all good, right? We try to have everything be perfect because we think it's supposed to be, and that's just not the reality. Is there any way that people can connect with you? Do you have a social media? Do you have an email or website, or where can people kind of learn a little bit more about you?
I am on Twitter. I will be honest, I'm not really on any other social media and don't engage that way a ton. But I
Nice. That's
am
okay.
on Twitter, or what is now called X, at RA Ollivier. And yeah, we'll have kind of a few, I think, things coming out in terms of trying to get, what we call knowledge translation, trying to get the research out there with podcasts and things like that. So
Nice.
my publications can be found as well on my ResearchGate profile as well. So if you want
That's
to check out the
awesome.
more academic literature, then that's where you can find some of that.
Thank you so much, Rachel, for sharing your expertise with us. Also, so cool that you did your PhD on this. I feel like 10 years ago, this wouldn't have even been a thought or conversation. Like when I graduated from school and my research projects, it was like back pain, knee pain. There was nothing pelvic floor related. And so I really enjoy seeing more and more of this sexual health, pelvic floor health research coming out. Helps all of us clinicians as well do better care for our clients. So thank you again. This episode will likely come out either late December or early January. So for those of you listening, I will share all of the links that Rachel shares with me in the show notes. And if you found this episode helpful, please share this with a new mom in your life, because even though you might not be talking about your sex lives, chances are that some people are struggling and you don't even know it. And so if this conversation can shed light to them on what's going on, why they're normal, and where they can get help, then that's amazing.
Definitely. Thank you for having me, Surabhi.
You're so welcome. Press pause.